You're watching WMC Action News 5.
Should pregnant women get the COVID-19 vaccine? The World Health Organization has changed its tune on the matter in just a couple of days. Local doctors are saying yes. WMC Action News 5's Camille Connor has the latest.
Pregnancy is a very stressful time for women. They're worried about not only themselves, but their babies.
And with the ongoing pandemic, pregnant women are wondering whether or not to get the COVID-19 vaccine. Nakia Grayson, director of clinical services at Choices, says some of her patients are hesitant when it comes to wanting to be vaccinated, but some of them are at greater risk for the virus because they're frontline workers.
Those patients, we really do help them to kind of navigate all of the information, and our recommendation usually is if their risk of exposure is great, that they probably should get the vaccine.
In January, the World Health Organization announced they could not recommend pregnant women be vaccinated unless they were at high risk. After receiving backlash, their position changed and now lines up with the Centers for Disease Control's recommendation, which advises pregnant women to consult their doctors about being vaccinated. Dr. Aric Giddens with Baptist Women's Hospital says clinical trials for the vaccine did not include pregnant women from the start.
Neither vaccine was studied specifically in a pregnant population. Pfizer does have some data in their studies about pregnant women who became pregnant when they got the vaccine or shortly thereafter, and they're following them.
Grayson and Giddens both say pregnant women are at a greater risk of becoming severely ill if they contract COVID-19. Even with the lack of data, the experts say pregnant mothers have reason to be optimistic when it comes to being vaccinated.
There have been no reports of adverse outcomes in pregnant women receiving the vaccine. So I think that's very encouraging.
Camille Connor, WMC Action News 5.